Every couple wants to have a complete family by having one or two babies, and some of them are still not able to conceive. That's when we call them as subfertility or infertility. I, Dr. Sunil Eshwar, infertility specialist and laparoscopic surgeon, working at Bangalore with IKEA Fertility and Research Center. Today we will be discussing about investigation in infertility. So when you talk about infertility, it affects it's because of both male and female. For any conception or a pregnancy to happen, both the gametes, that is the eggs from the woman and the sperm from the husband or the partner, has to be healthy. So today we will be delving on what is called as male infertility, certain misconception about it, and how do we go about treating it. So first to understand is, what is semen analysis, why do we do it, and how do we do it, and what is the interpretation of this semen analysis. Now, semen analysis is a very simple test where the husband or the partner has to give a semen. The requirement for this is that it has to be collected as a neat sample. Minimum 3 days of abstinence, that is either from sexual intercourse or from masturbation. 3 days of abstinence should be there. Not more than 5 days. This is what we tell everyone. But if the husband is working and he doesn't have so much time, or you just come from a long distance and you come for the first consultation, it becomes difficult for you to come and give the sample at any time. Again, we can always take the sample on any day, but it needs to be read by a good andrologist for a good interpretation. So that is semen analysis. It should not be collected in any condom, because many of the condoms will have what is called as spermicidals or lubricants, which can affect the outcome of the result. And there is no particular time of the day, morning, evening, night or evening cleanings also you can give it. It is your convenience. Now, how do we give it? As I said, it is more of an ejaculate sample, but some people have difficulty in giving the ejaculate sample in the clinic. So in our clinic, what we do is we provide a private room where he can use the available medias to assist for ejaculation. Next, if it is not able to come, we even allow the partners to be together for them to collect the samples. But in spite of this, if he is not able to collect, you can actually collect it at home also. We can collect it by what is called as because home you will be more comfortable to collect, so you can do the collection at home. When you collect at home, the rule is the semen sample should reach the clinic at least within half an hour to 45 minutes. So whenever you collect the sample, write down at what time you collect it and transport it to the clinic. No dunzoing or whatever the ways of sending the semen. It is always preferable that the semen sample is carried by the person itself, and no other person carries, or office staff or someone just handing over to some driver. No, that is also not allowed. Preferably you should carry it in your pant pocket or on a chest pocket, the shirt pocket also. But not to be kept in any kind of ice packs, and not necessary, because we know that semen or the sperms or the way it is produced, it's always in the little bit lower temperature. So it should be close to the body temperature, not very high, not very low. So you just carry it in a container. Generally, we provide a very wide mouthed container to collect the semen sample, and if there is any spillage of the sample, it should be notified to the lab when you are giving the sample. So this is about collecting at home. Again, collecting at home, condoms should not be used. We can also collect by one method called as coitus interruptus, but then yes, you should have if any ejaculation happen before collection, that again has to be notified. So this is the way we collect the semen sample and we try to analyze. This is the only test which is needed in terms of fertility investigation when males are concerned. But yes, it is not just the semen. Again, It is about the frequency of physical or physical contact or intercourse which you have. So that also we need to take a history and find out whether you are having a proper contact, or you are having any ejaculatory dysfunction or any other problem to have a proper contact. That I will talk in another video. As of now, we have talked about how to collect the semen sample and what are the implications of collecting semen sample. Thank you.